has been a very challenging time for the agency. By way of postmortem, how would you say that the agency did in coordinating the regional response for on behalf of English-speaking Caribbean governments?
CARPHA has, well, first of all, you said we were challenged. And I think we were challenged to be very creative, but also to be very anchored in what were the member states' capabilities, as well as being anchored in science. And so for you to ask me how we did, I would say that we have done a stellar job.
Mm-hmm.
But from the perspective of being objective, you look at how the member states, and we have 26 member states, which include English speaking, French speaking, Dutch speaking, and Spanish speaking. So it is not just English speaking.
Okay.
So from that perspective, if you look at our member states, by and large, the member states have had very low numbers, both of cases, deaths, and hospitalized patients. So the overwhelming of the health services has not played itself out in most of the countries.
Mm-hmm.
Some of the countries have been challenged. Haiti is one of our member states, for example.
Mm-hmm.
Or there have been spikes in cases or clusters, but none of the countries have declared community transmission or widespread transmission as yet.
Okay. Okay. Now, the region has been credited, as you indicated, with having some of the lowest incidences of COVID-19 cases in terms of infections as well as deaths. I know that you have a rapid response protocol in place. What role has CARPHA played in ensuring that there was successful coordination among all of the member states to ensure that process was smooth?
Well, the rapid response means specific things in the Caribbean. There's a rapid response mechanism for the Caribbean Disaster Emergency Management Agency. What CARPHA did is that we stood up the incident management team, and we have been producing documents, protocols, guidance, not just for health. We have also been working with the tourism industry because we have a tourism and health program. And so our response has not been so much in country as rapid response usually connotates, but we have been doing a lot of technical work and policy work because we have had mandates from the heads of government.
Mm-hmm. Mm-hmm. Okay. Now, the Caribbean is about to, some countries at least, are about to open their borders. And
some have already.
And some have already opened their borders, right? What role is CARPHA playing to ensure that now we're going to be having an influx of persons returning, a lot of them returning nationals from North American countries, to ensure that we can keep infections at bay?
So CARPHA had a mandate from the heads of government of CARICOM to produce a common public health protocol, which we did and submitted. CARPHA then had another mandate to work with impacts to produce a common border protocol, which we did and submitted. And we have also had a mandate to work with the tourism industry to support their elaboration and then implementation of tourism based COVID-19 response. So the influx that you're talking about, what most countries have been doing is repatriating the stranded persons or, for example, crew on cruise ship. But some of the countries have opened their borders to tourism. So CARPHA has also continued what it was doing from February 10th, which is providing testing support by PCR testing for samples that have been sent to us. Now, although the borders have been closed, we have been working with the regional security services air wing, and they have been bringing scheduled flights to the countries and then bringing samples to CARPHA 3 times a week for months now. So we have also been supporting not just through protocols and technical support and guidelines and interacting with sectors other than health and tourism, but also through the testing.
Mhm. Okay, and speaking of testing, now David Hinkinson in the Barbados Today newspaper, he published an article on May 28th in which he quoted as saying that the rapid testing kits were not the best way uh, of diagnosing COVID 19 cases and should be used only under certain circumstances. How are you advising regional health authorities on proper testing protocols?
So CARPHA has been issuing testing protocols which are framed through the guidance of WHO. So they have evolved. I think we're over 16 testing protocols that we have sent to the member states over these months. And one of the things that we have done is to advise on what these rapid tests do. Now, there are rapid antigen and antibody tests, but the critical thing, if it's rapid test, antigen, antibody, or PCR test, is that you should have preferably 95% or over specificity and sensitivity, or lower limit of 90%. The other thing about rapid tests, both antigen and antibody, is that they test for past disease. So if you're having a current infection, they really do not help you. And we're in the stage all over the world. Most countries have not got to the phase where there are large percentages of their populations that have had COVID 19 and are therefore producing antibodies. So the PCR test at this stage, and especially in the Caribbean, that has had fewer cases and has contained transmission to either isolated cases or clusters, antibody or antigen rapid tests will not serve for diagnostics or picking up current disease. So if you use them, you may get false negatives. So the person is actually positive, goes on, interacts with others, and spreads the disease. So it's a ticklish situation. So we have been following WHO guidance in that perspective. And we have also spoken about how tests can be assessed, these rapid tests, in the absence of a WHO approval or other recognized authority, how they can be assessed and what additional testing would have to be done of the negatives to ensure that you're not missing people who are spreading disease.
Mhm. And finally, Dr. St. John, how has the morale of your agency been affected by this? That's the first part of my question. And the second part of my question is for you personally, would you say that this has been one of the biggest challenges you've had to confront in your entire public health career?
So I'll start with my agency first. Early o'clock, we started an agency targeted safety protocol, which we have enhanced over time. And that includes having regular information sessions and staff meetings. In fact, that is a meeting that I'm going to, when I finish here, a general staff meeting. Apart from that, we have put certain safety measures in place, including the procurement of masks, additional cleaning and sanitization. Some persons have been placed on telework. Some people are on rotation, so you do not have a situation where you have many people together. Our lab staff, we have paid particular attention to them. We've done both physical and mental health assessments, and we have had regular mental health sessions with our employee assistance program for the staff, not just the laboratory staff. And we have tried our best to have a business continuity program which also thinks of the safety of the staff. So the morale from the quality and the volume of output, because every week I check their deliverables, what they've been able to achieve, and so on, and what they project for the following week. And the output has been fantastic. Um, so I have to assume that the morale matches what they're doing.
Yes.
For me, it is a challenge. And I said it's the greatest challenge because when you have a multi sectoral impact of the nature that COVID 19 has had on our economies through the effects on tourism and service industries, um, it is difficult to balance the needs of many in a situation which may challenge the lives of all. And so, also dealing with policy level, both ministers of different sectors and heads of government is not easy. So I have to say that it is the biggest challenge, but I love the challenge.
You said dealing with some of the heads of government is not easy. Do you mind expanding on?
No, I said dealing with the heads, not some of them, because we are mandated by all of them.
Uh-huh.
When I say we, I mean CARPHA and other CARICOM uh, agencies and organizations. There have been several mandates for protocols and procedures given to the CARICOM organizations by all of the heads. So it producing something that meets the standard of the heads and usually at very short notice is the thing that is not easy.
Right, right. Because, of course, given the urgency of COVID, I would assume that that made it much more challenging for you to be able to produce those deliverables in a manner that required their attention.
Not just required their attention, but their standards. Because this is not now a health domain only. There are several sectors involved. And it's not just government, it's also private sector and NGOs. And so to satisfy all is the issue. We know what to do, but to do it in a short time means not sleeping and working every day.
Right, right. Okay. Of course, I wish you the very best as we continue to navigate the challenges with respect to COVID, and of course the other public health issues that you deal with as well. Because COVID-19 before, and I would say this before COVID-19, occurred, we didn't really hear a lot about CARPHA and what CARPHA did. Right, CARPHA essentially became a household name after COVID-19 emerged. So finally, briefly, can you give us bullet points as to your other public health mandates for the region?
Well, yes, last week we had our board meeting, and the acting director in charge of the, most of the technical program delivered a presentation of the non COVID achievements and the COVID achievements. And the morning of the meeting, because the meeting started at 9, morning of the meeting, she said to me, I have had to cut down to 50 slides from 90. So that will give you an idea of the range of the work that we've been doing. So we have a chronic disease and injuries department, And in that, we also do the Cancer Hub for the Caribbean. We have environmental health and sustainable development. So there's environmental health and environmental management. And they have been working as well on other things. We have the Caribbean regulatory system, which has been approving new drugs that come into the Caribbean market at the regional level and then recommending them to national authorities. We also have the Medicines Quality Control and Surveillance Department, which has been testing medications that are in the market, post market surveillance. We have vector-borne disease. We have emergency management. We have usual surveillance. Um, we also have our communications department. We have our behavior change. So we've been doing a lot of work on psychosocial issues around COVID, but we've also been doing other work in that regard. Um, we have also been working on our annual report. We would have been preparing for our board. So the range of work that we have been doing way outstrips COVID, but everyone is paying attention to COVID.
Right.
Um, so I've just given you some of the areas of work. I haven't given you everything.
Mhm.
I would have spoken about the tourism and health program, but that has been going on and doing a lot of the standards, working on getting policy agreement from the Council of Trade, um, agricultural development at CARICOM. That process has been going on all the time. So we have had a huge amount of work ongoing. I forgot nutrition. We've been working on nutrition, but that has been curtailed a lot because we do a lot of in-country policy development with the nutrition sector. So we've been doing a lot of work separate and apart from COVID-19 preparedness and response. So please let me go. I
Yes,
need to get to my yeah.
because you need to run to your next meeting, but I will be following up with you for other interviews as time progresses. Thank you so much, Dr. St. John. Have a good afternoon.
Goodbye.
All right. Bye bye.